Good evening, everyone. Welcome to Virtual Past Six, applying for Pathology IMG Resident Q&A panel. Thank you all for taking your time to join us today, and we're excited to have you, so many future pathology applicants with us. Based on our feedback from previous events, we wanted to create a session for our IMG community, allowing everyone the opportunity to ask questions about residency application process, interviews, and Life with Pathology resident. Our goal is to provide an open and supportive environment where you can hear directly from our residents who have recently gone through the process and are happy to share their experience. In preparation for tonight's discussion, I compiled the questions that were most frequently submitted by the attendees ahead of the event, and we'll address those throughout the panel in addition to live questions. Before we begin our discussion, I'd like to introduce our panelists. As I call your name, please introduce yourself by sharing your name, your current postgraduate year, residency program, the medical school you attended, what drew you to pathology, and any subspecialties of interest you may have. We'll begin with Dr. Michael Christian Barada.
Hello, everyone. I'm so happy to be here. My name is Michael Christian Brada. You can call me Michael. So currently, I'm a second year APNP at Mount Sinai Hospital. So my track is really towards doing neuropathology fellowship, but I'm also planning to do another specialty in forensics after finishing my first fellowship. I was born and raised in the Philippines, so I graduated in a medical school in Manila, San Beda University. Thank you.
We'll have Dr. Hannah Xavier.
Hi, everybody. I'm Hannah Xavier. I'm currently a PGY4. I'm currently in my pediatric pathology fellowship, though I attended residency at University of Washington in Seattle. Now I'm at Seattle Children's Hospital, and I have matched into forensic pathology for my next fellowship next year. I am a U.S. citizen, but I went to a Caribbean medical school, so I have the U.S. IMG perspective. Specifically, I went to St. George's University in Grenada, and what drew me to pathology is I loved forensics. I worked as I worked as a deputy coroner for a year before I went to medical school and my master's degree. So I really was just in the long haul for forensic pathology.
We'll have Dr. Claudia Martinez Amador.
Hi everyone, I'm Claudia. I'm from Mexico. I'm currently at PGY2 at the University of Cincinnati. I did med school back in Mexico and then moved over here for residency. My interest, I think, is cytology at the moment. So yeah, happy to be here.
Dr. Manisha Regami. We'll go with Dr. Anna Savi.
Hi everyone, my name is Dr. Anna Savin. Happy to be here. I'm currently a second year pathology resident APCP track at the University of Rochester, which is upstate New York. And currently I'm interested in GI pathology.
Okay. So we're going to start with the application process questions. What did you do to make your ERAS application stand out for pathology?
I could answer the first question. I think it's more of if you actually see the program director's feedback from each match cycle. One of the most important things for pathology is the interest in pathology. So that's a very good question. I think what stand out most to my application is really my interest in pathology. Even started during medical school. So I started first loving histology, and then that histology really translated to pathology. And then one of the things that you can also make stand out to your application is by showing that you did the observership or electives to pathology, having USCE but LOR letters coming from US physicians. So there is a lot that you can, as a international medical graduate, that can stand out to your application. But the most important thing is to make sure that it's really tailored to pathology. So.
And what actually moved the needle in your application, and what did you over invest in that turned out to not matter for pathology?
I'm sorry, what's the question?
what actually moved the needle in your application, and what did you overinvest in that turned out not to matter within pathology?
Not to matter in pathology, probably my hobbies outside of it, just because pathology is a very niche, and also like my clinical experience. Because in the Philippines, I also worked as a emergency doctor, as a general hospitalist. So I think it's not something that would feel important in a residency application. So yeah.
Um, for anyone also, how did you approach writing your personal statement?
I'll do this one. Um, so I kind of have like a mixed view on this because I also was a chief resident last year. So I do some application review as part of that role. So when I wrote my personal statement without that knowledge, I decided to write about something about me that wasn't about pathology. So I actually wrote about backpacking because I love to go backpacking out in the woods. So I kind of touched on something outside of medicine and then related it to pathology. So I kind of made an analogy, I guess, about problem solving and critical thinking and kind of unexpected circumstances, because that happens a lot in backpacking and, it also happens a lot in pathology. So I thought that was a good analogy. Um, as far as like personal statement approach now in hindsight, after like getting to look at applications, I think a really common theme that I think a lot of people feel this way, but I think it's something that's used a lot is the theme of puzzles. I think that's better than nothing. And mine kind of had a little bit of a puzzle theme too. But I think if you can think of something else to write about your interest in pathology other than just solving puzzles, it'll help you stick out with your personal statements as opposed to writing things that other people have been doing for their applications as well.
Good. Did you tailor your application material for different programs?
I personally didn't. I sent the same thing to every single program with letters of rec, with personal statements. Everybody got the same exact thing. I don't know if any of the other panelists had a different experience because I know a lot of other people do that.
I think for me, this is a common question. And also in other panels, I've heard it whenever I was applying. One of the recommendations they did is that if you have like top five programs, kind of like personalize it for them. But actually, it's just like it's not gonna change a lot, in my personal opinion. So it's more about like telling about yourself and like be genuine about your interest. And I think that's also what matters a lot.
And how many programs did you each apply to, and how did you decide on that number?
So personally for me, and I mean, probably it's the same for a lot of people here. I just wanted to match somewhere, so I applied broadly everywhere. I think it was like 120 probably. Um, so I was like, I mean, I already moved out of my country, like I can move anywhere else, right? But yeah, I mean, yeah, to me that was my experience. I don't know if someone else has a different opinion.
I applied 80 programs. One of the things in pathology is that because I have a lot of friends who are applying for internal medicine, pediatrics, and they have a lot of programs. They're like 600, 700 kind of programs. For us, it's pretty unique because the last time I matched 2021, 2025, so I think there's 140 programs in total. But as a international graduate and a visa requiring candidate, some programs do not accept or do not sponsor visa. So that's also one of the things that limits me during my application. So I applied 80 for the most part.
I would like to also add I applied like 90 programs, and when I was deciding where should I put my application, where should I send it, I sort of made a tier list which programs I have higher chance of matching versus some dream programs, but they are more top tier. So I would suggest you guys, if, for example, every application costs money, and if you're limited in finances, it might be important to actually go to the website of the program and see how many IMGs they have. I believe there are some websites that have information about how many IMGs they usually have, like percent of IMGs in the program or something like that. I think Residency Explorer has that information. It is not necessarily up to date, but overall it gives you an impression. For example, some programs have 0% IMGs, so I wouldn't necessarily put your money to that application only to be rejected. So if you are limited in finances and you want to put your chances, if you're willing to match and everyone wants to match, I would highly suggest taking your time to really investigate all the programs and how many IMG percent they have. You can actually go to the website. Everyone has photos nowadays, and you can actually see by the last names or just how people look, which med schools they finished. You can kind of get an impression.
Um,
Oh, sorry.
no, you can proceed.
I was gonna say, I think I might be the last one. Mine's kind of similar to what other people have touched on. I applied to 77, and as Anna was saying, I had a similar approach. I divided that list into thirds. I had 33, a third were reaches, a third were safe, and a third were like, I will probably get into this place. My school though recommended to apply to over 100, but like Michael was saying, I think that's tailored towards residencies that have far more programs than pathology residencies do. So.
What was your, I guess in regards to red flags, how did you guys address those in your applications if you needed to? Would you suggest people to address them in their personal statement and what's your input in that?
I don't think I personally had one that I had to disclose, but when I reviewed applications, it was appreciated when there was a part in the personal statement where people directly addressed what the problem was, because it's going to be in the application somewhere, and how it happened, why it happened, and how they're now a better person because of it. I feel like is the big general consensus I like to see. If I didn't see it addressed anywhere, that's kind of more of a red flag than to just address the thing that's in maybe a shortcoming in your application.
Yeah, I think for an international graduate, when I was applying, I listed all the possible red flags for an applicant that might have. So I kind of like anticipated it during the start of my process. I think for me, it would probably, I'm not sure if it's really a red flag, but it's more of like having a gap years during the time of graduation and versus towards the time of the residency application. But, it's pretty common in being an international graduate. I think it really depends on how the program would classify it as a gap years, because for some programs, if you're working directly or you're practicing medicine doing research, then it's not considered a clinical gap years. But for others, it might be. So I think that's one of the possible, but not really like an outright red flag.
Yeah, I agree with that. I would suggest addressing your red flag somewhere in your application. Probably personal statement is the best place to put it there. But not just state this red flag. Kind of explain why that happened and be ready that during interviews it may be addressed again. So, for example, if you have any sort of gap years, even less than 5 years, that is a still gap. And be ready for questions like what were you doing during that time? If you were doing any sort of volunteer, or you were just preparing for your USMLE's exams, or you were moving to, I don't know, across the world, just be ready to those types of questions. Think about how would you best approach them so you could be very comfortable and confident in yourself during your interview. Basically, red flag is not something like a hard stop. This is just a question. So if you address that properly, I would say that it's going to be okay.
How much pathology experience did you each have when applying? Was it MLS background, home pathology, number of away rotations, and how did you go about finding clinical experiences in the United States?
For me, I graduated from med school and then did some research. So I didn't have any like type of pathology experience in the sense of like not residency in my country. However, during med school, I was interested in pathology, so I did some rotations over there. And then I was able to find an observership actually at the University of Cincinnati where I matched. Uh, I did that observership and I was working on research. And although I was not directly in pathology, try to look up for opportunities, right? Like it's not gonna be like a official rotation or something like that, but just like kind of like, hey, like I'm interested in pathology, can I just show up for the morning conferences? Which was something that happened to me at the hospital I was working at. I was like, I reached out to the program director and kind of like talk about it, and then she allowed me to go over there just for morning conferences. And that's how you kind of like create connections, and it's not official that you're rotating over there, but like it helps you to open yourself doors. So I think that's good, if you have that opportunity.
So my experience in pathology was also during my medical school, particularly second year in the Philippines. I'm not sure in in other countries, but that is where pathology subject is being introduced. So I joined a lot of like clinical pathological competitions, getting the right diagnosis, and I think that's one of my um, first exposure in pathology. After graduation, I also had a background in teaching histology, anatomy, and pathology in a medical school for 2 years. And then I also got an observership experience. I did each month in Stanford, Yale, and Mount Sinai, Mount Sinai West. Um, and how I got those rotations, it's totally different for each one of them. So the first one would be from cold emails. So I usually have an Excel file of all like the contacts because you can usually access it in every each hospital website. So I do have my own master list, and I try to make sure that I email them in a more personalized way and very concise manner. So that's how I got one of those. The other one is I met her during a pathology conference in the Philippines, and then we stayed connected. And then she subsequently sponsored my rotation in her hospital. And the third one is I applied directly to their website. So it's all different, and it just proves that you can literally gain an observership in different manners as well. You just need to be creative and really persistent. So yeah, I think as what Claudia said, for if you're rotating in a or you're doing your observerships, sometimes it's a make or break rotations, just because you are literally doing an audition rotation in the specific hospital, because the residents would get a feeling of how would like work you if ever you get matched there, and the perception of the residents from you if you ever got interviewed there and matched there. And my tip would be make sure to meet the program director during your observerships, just because during the interviews, usually meeting with the program director maybe like 1 to 10 minutes, but having the opportunity to meet them face to face is a different experience.
Before applying, well, I guess I graduated undergrad and then I worked as a deputy coroner for a year. So I had some forensic pathology experience, as I mainly worked in the autopsy suite. Then, as far as medical school is concerned, I did my clinical rotations, which is maybe a little bit different for some medical schools. For St. George's, they have partner hospitals within the United States with pre-established clinical rotations with those hospitals. So I picked a city that had the most hospitals with the most pathology departments that I could rotate through. And I pretty much rotated through all the ones in the Brooklyn, Queens area over the span of several months. So that would be my pathology experience leading up into applications. Um, As far as those rotations were concerned, like another tip is I rotated at a really, really small hospital in Brooklyn with only two pathologists. But one of those two pathologists was the chair of the department. So if you find a really small hospital, it's more likely that you'll spend one-on-one time with a chair, and then you can have a pathology chair letter as part of your application. I know some people in my medical school set up outside rotations with different hospitals. I didn't do that. I had a cat that I really did not want to have to move around with, so I just kind of stayed put. I only did one rotation at a hospital with a residency, and I was not offered an interview there. And I matched at my top choice where I never set foot in. So it's kind of your mileage may vary. It's kind of unpredictable, unfortunately.
I agree with everyone. My experience would be, I would say, a little bit different because I mostly found my observerships as I was working at Mount Sinai Hospital. So I started working as clinical research coordinator, trying to do something with my gap year while I was preparing my application for the residency. And basically, I was sort of kind of cold emailing people in pathology department. That's how I got my observerships. So I did my in-person observerships at Mount Sinai Hospital, and I did one online observership with a Russian-speaking lab pathology person that was not, I would say online observerships are an option, but not necessarily the best option because probably you wouldn't get that much exposure to pathology, and the person who you will be working with will not necessarily meet you in person and get a feeling who you are. So I would suggest if you have any sort of contact with anyone in the United States in the pathology department, try to go through them. And it could be not the first person in the chain, but you will email this person and then you will meet them and then that person will tell another person. So eventually you will go towards your direction. And also, I didn't use one of the ideas, but just as you guys were talking about conferences, actually, I know for sure that I believe OSCAP now has a medical student membership. And I would highly suggest going to conferences because you can meet so many people there. For example, I went as a first year resident there and I met so many people, and that's how I basically got my elective rotation for my possible fellowship placement. So I would highly suggest if you have an opportunity to go for the conference, for any sort of fellowship fair, any sort of open house, because we will have a lot of open houses over the next month or so. Just be active, show your interest, be polite and be nice, and that's how you meet people. We all are people, and pathology is a small world. So don't be discouraged if your emails are not answered. Eventually, you will meet someone who will introduce you to the world of pathology. And basically, like medical school in Russia, did not have any sort of exposure to pathology. So I didn't have experience at all, basically. And my observerships at Mount Sinai, I did only 2 weeks of in-person observerships. Of course, I did not state that in my CV. Like, I did only 1 week of this rotation and only 1 week of this rotation. I sort of tried to hide that. But I wanted just to tell you that if you are in a situation like this and you cannot necessarily take more time off because you're doing something else, you're working, this is not the end of the world and you will make it through.
Great advice. So we're going to move into the interview season questions. What type of questions did you get during your interview?
I feel like the most common one, and it's everywhere, like, tell me why pathology, tell me about yourself. how you became interested in pathology. Um, those are like the main three tops that probably, I mean, not memorize an answer, because if you get nervous at the moment, then you're just gonna start like thinking about the answer, but practice it at least so you know how or what to answer. But yeah, like not memorizing everything, because also people can notice that part.
Yeah, what worked for me is I have a bullet form of like what's important point that I want to share with my interview during when I get asked a specific question. But yeah, I do agree with Claudia, not to sound it like a very robotic manner that you really rehearse it well continuously. Yeah, so that's it can those are the most common questions, but I also got very bizarre questions. For example, like if you are peripheral blood smear, what is pathology? And explain it to me. So I was really caught off guard. So I think it happens for maybe some of my interviews, but most of the time it's like what is pathology? But like there might be some extreme questions that you might get asked. So prepare also for those. Also, the things that you put in your research can also be asked. I got asked during my thesis in my undergrad, which is like years ago. Luckily, one of my friends advised me to review my research, and then I answered the question. So just make sure that all your applications, all the information that you put in your applications are number one true, and number two, you really know the information that you put there, and then I think you'll be pretty good with interviews.
What surprised you the most about the interview process?
I think the biggest thing that surprised me is it was really just about conversational and kind of getting to know people. I feel like a lot of it is a personality litmus. Like, I honestly feel like, aside from why pathology and like asking about my general background, spent a ton of time talking about my hobbies and interests and what their hobbies and interests were. So I think a lot of the time it's also just getting to know people. I kind of went in thinking I was going to be put in these hypothetical clinical scenarios and what do I think's the best differential. That never happened. Everything just felt friendly. I guess another one of my bigger surprises, which is ultimately a good thing, is um, sometimes I'd mention wanting to do forensic pathology, and certain programs wouldn't have nice things to say about that, which ultimately is a good thing because then I knew not to go there for residency. Because ultimately, you want to go to a program that's going to prioritize your interests and your career and your needs for your training as opposed to what they want.
How did you prepare for your interviews? Did you prepare if it was going to be like a virtual, in person? Now everything's kind of virtual. What was your methods?
I think I can speak for one of the facets of it. It's also related to the first question, but what really got me challenged is the time difference that we have here in the US versus in my home country. I think all of us here can relate to that. So in the Philippines, we have a 12 hours difference, and most of the interviews here in the US are like 3 to 4 p.m. or like 1 to 5 p.m. And so my interviews are literally like 1 to 5 a.m. and I have to work tomorrow. So like 8 a.m. It was hard, but like one of the things that got me prepared for this is to make sure that your interviews are equally spaced to one another, and make sure that your schedule is free on the time, and then sleep early. Make sure that you literally prepare for that specific program, just because each program are different to one another. So I study the program before, or like 2 days before my actual interview, just to get a grasp of what's the program director, what's their strength and weaknesses as a program, things like that.
Yeah, I was going to ask, like, what questions did you guys ask the programs to help you get like a better sense for that fit? What are your keys? I guess five questions that you ask mostly through each interview.
Like, not everybody, and don't feel like you have to if you're this applicant. But if you already have fellowships in mind, talk to the programs about that and how best they like train their trainees to prepare for those things. How they think there's strengths and weaknesses as far as getting trainees into fellowships, be it at that program or a different program. And I think just like a general seeing if anything is changing or if things are stagnant in a program, I always asked, what are some changes that you think will be implemented before I come, in July 1st? Because ideally they have things that they're always working and improving upon. No program is perfect, even the ones that look perfect. So they should be working on something in some respect. And then I wouldn't say like a specific question, but just like general vibes. And I kind of had a scoring system where like vibes was part of the score. Like I didn't want to feel like weird and tense. I wanted to feel like I was going to be someplace that I could work and be challenged and learn, but also have fun and enjoy the people I'm with. And I felt like that was really important.
I
I
would
feel like Michael touched a point very important that you guys need to study the program before going into your interview because sometimes they're gonna ask you like why this program, and if you just like because I want to match into pathology or you don't have an answer, it's kind of like okay, so are you really interested in the program? So I feel like it's important to know the characteristics of the program, probably the day before the interview, just kind of like have some notes over there, read the web page or something that really interests you, like have that question ready in case you are asked, because I think that's important and that shows interest about that program specifically.
Yeah, I would add to this point because it is very, very different between programs. Some programs are very highly academic. And for example, if they will ask you whom you will see yourself in 5 years, the answer would be probably in academics. Versus if you're interviewing at a smaller program that is mostly community-based hospital, something like that, probably you would prepare an answer that you would like to try out approach of working in community-based hospital. So basically, it is very important to understand which program you're interviewing in, because if you will tell to a smaller program that you're very interested in research and you cannot live without research, that would not be valued. So make sure that you know which program you're interviewing in. Also, in terms of questions, I believe there is a running list of all the questions you may ask, and as highly anxious person, I always had on my background this running list just in case to make sure that if a person will ask, oh, we have some time left, what kind of questions do you have for me? So, and of course, I would go blank in that moment. So for scenarios like that, I had like 100 questions list. My favorite question of all would be what is your biggest strength of your program and what is maybe some area that you would like a program would work on. And I think another very important and good question is can you think about some point when the program maybe approached your feedback? So, for example, you gave some sort of feedback about this rotation. And can you just tell me more how the program leadership approached this situation? Did they do anything about it? Or they just sort of brushed it off? Of course, I would highly suggest putting all these questions in terms of like, for example, questions about grossing. How much grossing do you guys have in your program? I would not put it like that. I would say, oh, I don't have much experience in grossing, so I was wondering how much opportunities I would have in your program to, learn more skills in grossing. And if you put it like that, the people are more willing to share the information because you're not opposing yourself to them. You're genuinely have interest in the program.
Yeah, I agree with all of those statements from my co-panel. I think for me, I also ask very technical questions just because do I see myself working in this program? Because I'll be working in this program for the next 4 years, and I want to make sure that I'm a great fit, and they're a great fit for me, like a vice versa thing. So I asked like how many pay support do you have? Is it a general or subspecialty sign out? Is there an open door policy to the attendings, research opportunities, and also how flexible it is to ask an elective or an outside rotation. For some of my, I also encountered questions like for those for parents like for health insurance, is there any daycare, kind of like that thing. So it's okay to ask very technical questions because that will help you decide during the ranking list.
So we're going to move on to the choosing and ranking programs. What factors did you prioritize when ranking programs? Location, reputation, size, fellowship opportunities.
Yeah, maybe I could kick you first. For me, it's visa. So during my time, um, it's March 2025. Most of the programs that I got interviewed are offering H-1B visa. So during my time when I was when I was ranking, I literally segregated those programs that offer an H-1B versus those programs that offer J-1, just because of how flexible H-1B is and could be a direct pathway for a green card in the future. And like J1, you need to secure a waiver job and then you can transition to H1B. So it's a very difficult and long process. So that's number one for me. I think for now, most programs offer J1, so it could be really hard to differentiate which program it could be, like during the ranking list. But I think one also factor for me is the location, just because, um, for example, I grew up in Manila, which is a very big city, so I see myself also working in a big city.
For my rank order list, I was really focused on because unfortunately it's a specialty, not a lot of, I mean, I'd say a lot. A lot of people respect it, but there are programs that don't. I wanted to know I went to a program that respected the fact that I wanted to do forensics. So I ranked programs higher that had a partnered forensic pathology fellowship or forensic pathology fellowship within an hour, or used forensic pathologists in general hospital autopsy teaching. So for me, I just really wanted to make sure I got as well prepared for my future career as possible. Um, I was kind of willing to live wherever in the United States. I did try to be a little accommodating to my spouse, so I tried to pick something that also worked for his job too. So sometimes I think that might go into other people's rank order lists. And then I think lower down the list would be like, I don't know, like regional kind of like hangups, like maybe like not middle United States for whatever reason. But I really just try to focus on being as best prepared for my career in the boards as possible with my rank order list.
For me, I remember I put a list. So every time I had an interview, take notes. That's kind of like good advice as well, because then you're gonna forget. Then you'll be like, oh, is this where they asked me this and I think I didn't answer correctly, or like kind of like that stuff. So you're gonna forget things. Um, I will take notes every time I have an interview, just like general vibes that you had. Oh, like I see myself there, or oh, I feel like probably it's like a little bit lower in my rank list. To me, it was important location because of my husband's job. So we wanted to be in a city that will like big city. Cincinnati is not that big, but it's a medium-sized city. It's really cool. And then also, I feel like whenever I came here for my observership, you get the vibes of the workflow and everything. So that was also, I feel like I was lucky to have that opportunity to feel like, oh yeah, actually I can see myself working here, the environment, the opportunities they give to all the residents. So it's really important to take notes. Go with your gut feeling as well, because a lot of people try to like, oh yeah, the match process works if this person, like I feel like you're never gonna figure it out and then just go with how you feel. If you actually believe that you can work in that place and you really like it, just go for it. But yeah, do take notes whenever you have an interview, because then you're gonna forget things about it.
Yeah, I agree with notes because unfortunately, by the end of the season, everything blends together and you cannot really separate one place versus another. For me, when I was putting my rank list order, I would think that probably for me the most important factors were the number of fellowships that the place has, because technically, if the place is willing to open a fellowship, it suggests that they have enough amount of specimens of this specific subspecialty that they may suggest fellowship. Because if they would not have that volume, they would not open the fellowship there. So, amount of specimens that they receive per year. For example, places that have super busy, like New York City, they have crazy amount of specimens, busy programs, versus some smaller programs that have like 20 to 30,000 specimens per year. So depending on your goal and depending how you feel, it is mostly suggested that it is optimal to see like from 30 to 80,000 specimens per year. This is like golden middle of some sort. More than 100,000 specimens per year is kind of a lot, but also you may think about how many residents they have in this program, because if they have a lot of specimens, they may also have a lot of residents. So the volume per resident is not that high. And of course, your gut feeling, your vibes, just go with it, just trust it, because I don't know how to explain it, but I matched at my top one, and I just immediately when I just went to open house, I was like, okay, this is the place I want to be. I don't know, some sixth sense of some sort, and I'm so happy with my program. Your gut will never lie. So even though you have a perfect, I don't know, super Yale mayo or something like that, if you love something else more than that, just choose that. Choose your heart. Because it is very important. Of course, learning is very important, but residency is so hard. It is very important to be surrounded by people who can support you and to be in the place where you can actually be happy. Because if you're happy, you can do more versus being in a place that is super academic, highly competitive, but you will feel miserable. So that is my number one advice. Trust your gut.
Also to add, I think it's very important also to know how the NRMP match application algorithm works, because I've heard that there are some misconceptions that some applicants would rank programs higher just because they feel like they're matching in this program, or these are the safe programs that most likely they'll get into. The matching algorithm is very favors the applicants. So rank the programs that you really want to go into, and not just because you think that you might get into that program. I think that during our application process, I remember the NRMP sending a video of how it works. And it's available in YouTube, so maybe you can search it up, like NRMP match algorithm, and then you'll know like the different probabilities of how an applicant could get matched, and you would know there that the end of it, that NRMP favors the applicant and not the program.
I had one more thing I remembered midway through too. When I think notes are very important because you're going to forget things, and that's already been touched on. But when I applied for Match, so I matched in 2023, there was this application called Prism where it had preset things that you could score a program like between 1 and 5 or something. So it'd give you an objective rank order list based on it meeting your needs. I did not submit my rank order list 100% by what that came out as. I probably flip-flopped a couple of things in there, but nothing too wild. I don't know if it exists anymore, but I did something similar for my forensics match where I put my things that I want on Excel, and then I give them a score of 1 to 5, and then I saw what their scores were at the end. And again, it led me be a little bit more objective for things I might have forgotten throughout the application cycle.
How did you research programs beyond what was on their website?
I don't know if anyone heard, but there is a perfect source of anonymous information on Discord channel. And they are running a spreadsheet every year. Of course, every information you should sort of put it through your critical thinking. Sometimes some things are not necessarily true, but you can get a feeling of that. Your friends that are in the programs already, they can hear some things that are not publicly available. So they are also a great source of information. Residency Explorer is a good website in terms of like IMG percent, how many people would stay for fellowship versus go somewhere else. Fellowship placements of graduates is also an important thing. So yeah, take your time to really invest your time, resource in the programs, because you can save a lot of money if you're not putting your application to the programs that will deny you. But at the same time, don't be afraid to apply at the programs that are more competitive, like your dream programs. Believe in yourself, because some programs, even though they are top, they really put their time and evaluate you as a person, even though you are IMG and you may think, oh my God, I need a visa or something like that. Some programs don't care. I don't know how many, but the programs really care about applicants as people. They do not care about your visa status. So put effort put your time in personal statement in your application. Just make sure that you're ready, everything is nice, and you'll get there. So believe in yourself, research programs, but at the same time, if something is like, for example, I don't know if Duke University now has IMGs, but at the time I applied, it was 0% IMGs. So I did not apply there because I was like, okay, I'm IMG, they have 0% IMGs, so I will not apply there because they will deny me. Maybe that changed, but I don't know, 1% IMGs, 5% IMGs, depending on your visa status. Again, research programs and research what they have.
That was good advice. I definitely have been seeing myself do that of looking at if there's IMGs and if there was not within the past 2 years, I'm like, possibly not to do that. So good insight. What do you wish you had considered more when making your rank list? Hard to say, you're all at the good places.
The question was, what is the most important factor when considering the rank list?
What do you wish you considered a little bit more?
That's a hard question because I'm pretty happy with the place I ended up. So I don't have any regrets. But maybe I would say um, public opinion. Like, for example, I was consulting one of my friends, pathology residents, and she was like, girl, you have interview with Mayo Jacksonville. This is Mayo. You should go to Mayo because this is Mayo. And I was like, yeah, but at the same time, I love this place more. This is your life. So put yourself first. Again, trust your gut. So even though you can listen to advice, always prioritize your opinion. So Doximity rating, all the public ranking systems, I would say look through it because they probably have some sort of information they are based on. But at the same time, go with your opinion first because this is your life and this is your choice.
Something I didn't even consider at the time, but became very important to me was perceived flexibility with the program. So I actually matched APCP. My program's kind of funny where we do two pure AP years and then we do two pure CP years. They're not intermixed. But the longer I was sitting in didactics and seeing CP topics, I was like, ooh, this is not for me. So it was really nice now, 2020 in hindsight, to be at a program where I went to my program directors and I said, hey, I don't think I want to do CP anymore. What can I do instead and what kind of flexibility? And my program was really, they really just want to make sure in the end you're competent and you're happy. They're not going to force you to work or force you to do something just because you signed that contract in 2023 when you didn't know any better. Just like we had a resident this past year come in as AP only and realized he really needed to be CP only, and they let him switch. I think that's something that might be hard to ask or gauge in interviews, but I'm very grateful I could make that switch. I wouldn't have done this pediatric pathology fellowship if it weren't for them allowing me to drop my CP training, because it kind of gave me a year back of my training to do something I felt like supplemented my career better. So I think if there's a way for you to consider that, I think I would have really been of good use in 2023 when I matched.
Yeah, so I think the question was something that you did not consider during applying. I think for me, it's the number of IMGs that got matched into specific programs, just because my thinking is that the reason you're applying broadly is that for you to get the chance to get to match in your dream hospital. So I match in Mount Sinai Hospital, which has a very low percentage of IMG, and my program is APNT, which is like one slot in my track. I would say it was very hard at first, just imagining going through that process. And I was during my journey when I was applying, I've received comments and feedbacks from my mentors and from my friends who are also applying the same match cycle as me, that it's a reach program to apply in that hospital, but you know your capabilities. And even if you sometimes you have an imposter syndrome, the reason why you get the chance to apply is because you get the opportunity to have you have the opportunity to apply for it. So you won't be in the room if you're not qualified for that specific situation. So my advice is just apply for the programs that you think you want to be in there, and don't mind the number of percentage, because that is variable and that could change per year. Number two is that I think it's also important to ask the in-house fellowships, just because in-house applicants will always have an upper hand compared to outside applicants. So, for example, DermPath fellowships, in our program, our DermPath accepts in-house pathology applicants compared to other programs that only accept derm applicants. So there's a lot of nuance around different fellowships. So always take that into consideration as well.
We're going to go for advice for applicants. What's something you wish you had known before applying? Cost, I'm sure. I'm sure we're all as it keeps going, it keeps adding in. I get surprised each time.
I think that's a huge one. My school allowed us to pull out more federal loans to play towards our applications because they knew we spent so much on it. I think another thing that's beneficial is any sort of extra fun kickbacks your program gives you. Like, let's say, paying for step three. That's like a good way to save money. So like my program pays for step three, but it does not pay for the boards, which are like $2,000. So like that's like a difference. Um, that's the first thing that comes to my brain right now, at least.
I feel like for me in general, just to keep pushing, keep going, everyone's path is gonna be different. Um, Probably reaching out. It doesn't matter how many emails you send, someone is gonna answer that email and it's gonna open the door for you. It's just like I know it's tiring. I know it's like sometimes you're like, oh my God, what am I doing? Like, do I really need to go through all of this? But at the end of the day, it's all worth it. And just kind of like keep going and keep pushing.
Yeah, good advices. I think for me, it's more of focusing on the things that you can manage and not focusing on the things that you cannot manage just because it would just literally stress you out. For example, the things that you can manage are getting preparing for the STEP exam, securing observerships, and like the things that you cannot manage, for example, are the visa, which is very which has a lot of changes recently, your year of graduation. So they might appear as a red flag, but again, these are the things that you cannot really modify and just focus your attention on the things that you can still manage on your application.
I wouldn't say something like that I wish I knew, but maybe as a sort of personal note. I wish that I was maybe more confident in myself because at the time of application, I was like, oh my God, I'm IMG. I am like inferior to all American graduates or something like that. But now, as I'm past, like I'm a second year resident now, and actually I'm seeing that this is not the factor that really puts you down or something like that. It is important who are you as a person, how much interest you have in the program. And I would say that even though we have all these obstacles with visas and all of that, if you are passionate about pathology, if you have a strong interest, show that interest when people are inviting you for an interview or you're at the open house virtual event. Just show your interest, be genuinely interested in the program, ask good questions, just be a normal human being, and it will tell people about you because they can see that you are not a robot, that you are a genuinely nice person and you're very interested in their program, and they are really taking that into consideration. Be very polite with everyone, even like program administrators, coordinators, they all are working very hard and they are all making a decision. They like, even if you're interviewing with a resident and everyone is saying, oh, we're just interviewing you, but this, like, I'm not putting you into a rank. This is kind of true, but not really, because we always are like our program are always interested how we see this particular applicant. So my advice to all of you guys, if you're interested in pathology, show that interest, be polite. I know it's very hard to go through interview season with same energy as you started. It gets really draining towards the end. But every time, put this smiling mask, be really genuine, be your best version of yourself, and really show that interest in this particular program. Each interview, each open house is a chance. Take that chance and show yourself, show how wonderful you are, and people will see that.
We have a few more questions. Um, what makes a student stand out on a pathology rotation or elective?
Okay, so I kind of had to like herd all the rotating medical students last year. I think one is independence, like going on the rotation, and even if there's nothing for you to do, find something. Go to the gross organ review conference, go attend some sort of tumor board, go find something to read. if there's some sort of interesting case that a resident has. Like me seeing that you can independently apply yourself into the service already as a medical student shows me that like when you come to work that you're going to find the issues that need to be solved on your own without somebody having to tell you. So that's like a really good thing. And then just like generally applying yourself and being interested. Like it's easy to tell the people who are really interested and passionate in the field versus people that are applying into pathology because they feel like it's a safer option for them, quote unquote. So just really find your own kind of activities, things to do, as well as applying yourself throughout the day.
Yeah, someone who has a lot of like also medical student rotating in our hospital, the expectation of you knowing all the diseases is none, just because we know that you're a medical student and then you'll learn all of these things whenever you decided to apply for pathology. So just, being on time and being present, especially during sign out, just because I've experienced like some observers or some students being on their phones or not really being interested during sign-ups, um, does really go a long way during application process. Um, yeah, so just showing up during your rotation um, really makes a lot, and being interested in the actual pathology day-to-day workflow.
How important are research and letters of recommendations?
I think letters of recommendation from faculty in the US are really important. So if you at least can have one from the US, that will be very helpful. I also feel that it's hard nowadays to find an observership or any US opportunities. Um, but what they were saying is that if you have a very strong recommendation from someone that genuinely knows you, that's gonna speak volume rather than, okay, yeah, the chair of the department, but that person just like say hi to you one time. You know what I mean? Like they can talk to you more about the type of work that you do, someone that actually knows you, rather than just looking for big names and other other stuff in your letter of recommendation. Research, I feel like well, it might vary between programs. In my program, it's not important or required. I mean, if you have it, that's like a good thing you can talk about. You can just like share more about you, but it's not like a requirement or like, oh, if you do more research, you have an advantage.
Yeah, research, like research is still part of the application process. So if you have any research during your undergrad or during your medical school as a thesis, you can also put it in there. And I agree with Claudia. I think it's very variable depending on what programs. And this is just based on my perception, but I think research has a value on like more university hospitals just because of how research the capability of research and or research opportunities they have it in there. Um, but having no research doesn't mean that it's like a huge stop for you during your application process. With regards to the LOR, I agree that that US-based hospitals pathology is way more um, than your home country. So what I did is I had during my application I have four letter of recommendation. Three of them were from the places that I did my observerships, and the other one was my mentor in the Philippines who known me for years. So that's also helpful.
All right, it's about 5 minutes past the hour, so we can start closing out now. If anyone has lingering questions about the process, we do have two upcoming events that you can register for that I dropped the link in the chat. I'll stay behind and yeah.
Yeah. I guess one piece of advice you guys would give the audience as your closing statement.
I think in hindsight, at the time it feels like so daunting and so stressful. And I just remember feeling like the weight of the world on my chest, the whole match process and just this doom. And really afterwards, it's just done. It's just going to be a process. It's going to be stressful for a while, but like, no, in the end, you're going to match. It's going to be okay. And I think the biggest thing is just like be yourself. Um, Kind of express yourself outside of medicine, I think is so important and it makes you more memorable to the programs. So, be a human being and you're gonna be all right. We're all gonna get through it.
For me, being motivated goes a very long way during your journey, just because I think it's a very stressful journey from steps to matching. So, when you wake up, tell yourself you can do it every day, and then, yeah, you become motivated.
Yeah, for me, it's just take one day at a time. Like what you can do that day, and then the next one is another opportunity, another day, and then you can do more things. So just one day at a time, and whatever you can do that's in your power, just go for it, and it's gonna be great.
Yeah, exactly. I agree with everyone. Like if you had any sort of um, cringe experience during interviews or you, I don't know, forgot some words due to language barrier or something like that, it's okay. Just okay. It happened. It is not the end of the world. We're going forward. Every day is a new chance. Every interview is a new chance. So just don't focus on something that brings you down. Focus on something positive because, again, this is a very daunting and exhausting process, but it's going to be over. So just take your time to prepare for the interviews. Before every interview, just sort of print out your CV just to remember who am I? Why am I interested in pathology again? Yeah, and be yourself. Be your best version, but be yourself. And don't forget to smile. You're gonna get through it.
Yeah. As we wrap up tonight's panel, I just wanted to sincerely thank our incredible resident panelists for joining us, taking time out of their schedule and sharing their experience and advice. I wanted to thank everyone for joining us today. We hope the discussion provided valuable insight from the residents. We encourage everyone to continue networking, reaching out to mentors, supporting, and keep a lookout for our social media page for upcoming announcing events, resident panels, opportunities to connect with members. And on behalf of the entire PathSig team, we thank you for tonight's event and we hope to see you guys soon. Thank you. Thank you, everyone.
Good luck, everybody. Bye.
Bye.